Student number 3, Kat Miranda. Alright, head up table, thumb, spine is pushed for T1 to T3. This is the right posterior contact point, tip of the thumb on the right hand, segmental contact point, inferior lateral aspect of the spinous process, stabilization point, left mastoid, segmental stabilization point is left thenar, line of correction straight, L to M, forearm perpendicular to the segmental contact point and parallel to the floor.
So you heard one on your videos.
It just comes along for the ride.
And what is the one that where you
Turn you this way, please.
Patient seated.
no,
Oh, you're thinking of the prone occiput lift.
Supine thumb pillar push for C2 to C7. This is a right posterior. Contact point is the palmar surface of the thumb of the right hand. Segmental contact point is the right posterior articular pillar of the involved segment. Stabilization point is the palm and fingers of the left hand. Segmental stabilization point supports the occiput and upper cervical of the left side. Line of correction is P to A, I to S with a counterclockwise rotation.
You talking to me or her?
Go. Go.
They do the same way. The same thing, I guess.
Everybody's got their own thing. I stay out for the TVPs because they tend to be a bit
And there.
sensitive.
Well, that makes sense to have a wider.
We have a prone index pillar push, ipsilateral for C2 to C7. This is a right posterior. Contact point, lateral aspect index finger of superior right hand. Segmental contact point, posterior aspect of right articular pillar. Stabilization point, thenar of left inferior hand, traction cephalad. Segmental stabilization point, left mastoid and posterior inferior occipital rim. Line of correction is P to A, I to S, in line with the plane of the disc with the forearm parallel to the floor.
Okay. Turn your head this way, please. And thrust his back.
Seated hypothenar mastoid occipital lift, RPS. Contact point is hypothenar of the right hand. Segmental contact point is right mastoid and inferior occiput. Stabilization point is the hypothenar of the left hand, reinforcing the contact hand. Segmental stabilization point is dorsum of the right hand. Line of correction is P to A, I to S, L to M, with a scooping motion.
just keep rolling. Stabilization is my superior hand
Alright, supine anterior thoracic contralateral for T4 to L1. This is an AI. Contact point is hypothenar and thenar. Distal phalangeal joints 2 through 5 of inferior hand. Segmental contact point, posterior inferior aspect of right and left TVPs, 2 to 3 segments below vertebra in question. Stabilization point is calcaneal aspect of superior hand. Segmental stabilization point is low elbow. Line of drive is A to P, I to S, parallel 6 degrees of facet joint angle.
Are you ready?
Your head up, please.
1, 2, 3.
Go.